শুরু হয়ে গেছে। ওটাই তো আবছা আসছে কেন? আচ্ছা হয়ে গেছে, যা টাইম লাগলো আবছা থেকে।
Welcome to the Rupam Said YouTube channel, guys.
না 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 থাক, জুম করলে কেটে যাবে।
Hello guys. Hello guys. Welcome back to my vlog.
গ্রামটা আবার কি একটা হয়ে যাবে।
হ্যাঁ এইবার শুধু এইটা এখানে বাংলাদেশ, তারপর আমাদের নাম এখানে আমি
দাম
তারপর এখানে সিকিমা
হয়ে গেল। কতগুলো এ দিয়ে জায়গা রয়েছে, সবাই এগিয়ে হয়েছে কেন?
আমি এখানে চলে কত এগিয়েছি।
So a little bit about the indirect invalid hernia, the types of indirect invalid hernia. Okay, only this one is left from yesterday's class. So you are supposed to understand what is this part. In case of embryological development, this part will be exactly what is the processus vaginalis. That is nothing but the peritoneum which will be dragged downwards like gubernaculum testis over here. So this is the peritoneum which makes the way for the testis to come later on. Okay. So if this processes, switch off the exhaust fan. Switch on the exhaust fan.
রাহুল, এক্সস্ট অফ করে দেন।
It will be written over there.
एक कार नाम इस कार की
Plan, okay, sure, plan.
জীবনে কষ্ট হচ্ছে অ্যাকচুয়ালি। আমার তো ঠান্ডা লাগছে না, এটা
তোমার ঠান্ডা লাগছে।
Always belongs to this.
থ্যাংক ইউ।
First of all, this alveolar structure is the processus vaginalis, which is a peritoneum which is making a way for the testis in case of afterbirth. Okay. So this peritoneum you can see over here. Okay. So music also.
ভিডিওতে অংশ
Fine. Okay. If the processus vaginalis is persistent, okay, still even after birth also, if it is persistent, this will make a way for the intestines to get herniated. Getting it out? Okay. So this is of different types in case of indirect hernia. Okay. So all these things belongs to indirect hernia. Why not direct hernia? Why the processus vaginalis belongs to only indirect hernia? Why not direct hernia? Absolutely, that is the thing. Okay, because the processus vaginalis will be brought downwards through the inguinal canal, not through the walls of the abdomen. Walls of the abdomen in case of elderly people, but in case of youngsters, the commonest hernia is indirect inguinal hernia. Okay, so this indirect hernia is of different types based on the persistence and absence of the processus vaginalis over here. So if there is no processus vaginalis, okay, because it will be atrophied in case of after birth, so no hernia will occur generally. So if this is persistent, that means this is the peritoneum over here. Processus vaginalis, indirectly you can say that this is the peritoneum. So this is the peritoneum, the deeper structures will be the intestines over here. So the intestines will easily herniate over here. Get it or? Okay. So the peritoneum is making a sac over here till the testis over here. So this is a persistent processus vaginalis over here. Get it or? So it is present even after birth also. This should not be present even after birth. It should be lost. Okay. So if it is persistent till the lower aspect or if it is reaching the testis, It is called vaginal type of indirect hernia. Okay, vaginal means processus vaginalis as a whole. Okay, right. So if you see over here, this is termed as funicular type, which is the commonest type, which will be asked in the examination. Funicular is the commonest one. Okay, what is funicular means? Again, the process vaginalis will be persistent, but just above the testis it will be intact, but below that it will be lost. Could you understand? So it is reaching till the testis over here, but it is not reaching till the testis. This part in front of the testis is lost or atrophied over here. So till this part just above the testis, this process vaginalis is intact. So the hernia will occur till this part only. Okay, it will not reach the bottom over here. So this is called funicular type. Okay, and then followed by infantile type. Okay, infantile. Okay, infantile means, see, this process vaginalis will be persistent even in front of the testis also, but it will be persistent till the superficial inguinal ring. Beyond that it will be lost. Getting it or not? So till the superficial inguinal ring, this will be persistent. Beyond that it will be lost. Okay, only from the superficial inguinal ring till the testis, this process vaginalis will be present over here. Again the herniation will occur till this part over here. Getting it or not? Okay. So here beyond this the process vaginalis will be lost. That is called the infantile over here. Okay, right. The last one is interstitial. Interstitial, you can understand. Interstitial means generally. Space between the tissues. Is it not? Interstitial space means in between the tissues there is a space. That is called the interstitial space. The same as the interstitial refers to in between the superficial fascia, aphasia, and external oblique. That means this process vaginalis will be persistent in between the walls of the abdomen. Okay, in between the superficial fascia and external oblique, there will be persistent process vaginalis at this point. Okay, or in between the fascia transversalis and the peritoneum over here. Interstitial, in between the walls of the abdomen over here, anterior abdominal wall over here. Okay, so in between the walls there will be persistent process vaginalis. That's why it is called the interstitial type. Okay, so this might be a short notes. Okay, but among them, funicular is the most commonest form of inguinal hernia which occurs in the kids, young adults. You can say it's not young adults, kids only. Okay, so what infantile? Yeah, sure. Infantile, from the testis till the superficial inguinal ring, this part will be process vaginalis will be intact. That means this part of the process vaginalis will be persistent. So beyond this, that means from the superficial inguinal ring, the inguinal canal and the deep ring over here, everywhere the process vaginalis must be present generally. Okay, so this part will be lost. Getting that? Okay. Normally, in case of adults, this process vaginalis will not be there. This process vaginalis will not be there. Okay. So this will be lost in case of afterbirth case of it. So in certain cases, this process vaginalis will be still persistent. Okay. So that will be leading to the herniation over here. So here you can see this part is lost because of funicular type. This part is lost. Rest of the part till the deep inguinal ring is persistent over here. Here also till the deep inguinal ring it is persistent over here. Okay. But here only this part is persistent, but beyond the superficial inguinal ring reaching the deep ring, this part is lost. Okay. Only this part is present over here. Getting it? This sac is present over here. And again this part till the deep ring it is present, but it is not reaching the testis over here, but going in between the anterior abdominal wall muscles over here. Understood or not? Right? Understood or not? So these are the different types of, understood or not? Right? These are the different types of indirect inguinal hernia. Okay. Direct means clearly it is passing through the walls of the abdomen. Okay. So today we will see today's class is actually what the peritoneum and how the viscera are placed within the peritoneal cavity. Okay. So what are the boundaries of the abdomen first of all? What are the boundaries of the abdomen? Above will be diaphragm, is it alright? Below will be pelvic diaphragm over here, and on either sides will be mid-axillary lines. Mid-axillary lines, okay. Above will be diaphragm, below will be the pelvic diaphragm. So these are the boundaries of the abdominal cavity. In front of this axillary, mid-axillary line, this part is called the anterior abdominal wall. Behind that will be the posterior abdominal wall. So anterior abdominal wall is differentiated from posterior abdominal wall by means of mid-axillary lines. For entire abdomen, this is the roof and this is the floor over here. It's common. Okay. So first of all, to understand the peritoneum actually the lecture classes are also there. Tomorrow and after tomorrow there will be lecture classes. But basically you are supposed to understand how the peritoneum is lying in the abdominal cavity. First of all, the organs within the abdominal are intra-abdominal, but extra-peritoneal. Okay, what it means actually? Okay, what means it? Okay, retroperitoneal. What is the meaning of this actually? Retroperitoneal is okay, but intra-abdominal and extra-peritoneal. What it means actually? Outside the peritoneum and within the abdominal cavity. Just like the biceps sternum, it is intracapsular but extra-synovial. Okay. For example, this is the abdominal cavity, for example, which is lined by peritoneum on the inner aspect. For example, this is the peritoneum on the inner aspect. Okay, right? So this peritoneum will be going inwards or invaginates into the abdominal cavity and suspends the different organs over there. For example, take the liver over there. Okay. So the liver is now within the abdominal cavity, but this part, whatever you are seeing over here, this closed cavity is the peritoneal cavity. But this liver is outside the peritoneal cavity over here. Do you understand? This peritoneum is filled with the peritoneal fluid. Just like the visceral and parietal pleura, visceral peritoneum and parietal peritoneum. By this you can understand, right? So this organ is outside the peritoneal cavity, but within the abdominal cavity over here. Okay. So this part is very much important. And we have a term called retroperitoneal. What is retroperitoneal? Retroperitoneal. Okay. To understand, retroperitoneal is just behind the peritoneum. Or for example, if this is the anterior abdominal wall. For example, this is the anterior abdominal wall and this is the posterior abdominal wall. Okay. Which is lined by the peritoneum on the way over here in this line. For example, this is the pelvic cavity. Pelvic cavity is not lined by the peritoneum. Okay, remember this. Pelvic cavity is not lined by the peritoneum. Only abdominal cavity is lined by the peritoneum. Okay. So this is the anterior wall, this is the posterior wall. This is the entire parietal peritoneum over here. Okay. It is lining the walls of the abdomen, which is also called the parietes. Parietes means parietal walls of the abdomen. Getting it? So this is the posterior wall. If any organ is situated in between the peritoneum and the posterior abdominal wall, it is behind the peritoneum. Getting it now? So for example, this is the kidney, for example. Okay, kidneys are the retroperitoneal structures. Okay, that means the kidney will be situated towards the posterior wall, but deep to the parietal peritoneum over here. That means in between the parietal peritoneum and the posterior wall, if any organ is situated, that is called the retroperitoneum. So whatever the organs which are present over the back side, posterior wall. So what are the different types of retroperitoneal organs? If you understand that, rest of the organs you can understand easily. Okay, what are the different peritoneal organs? Retroperitoneal organs, first of all, kidneys,
Suprarenal glands.
kidneys along with suprarenal gland.
Pancreas except for the tail.
Suprarenal gland. Okay, then followed by
The pancreas
pancreas. Okay.
except the tail.
Okay. Ureter, obviously ureter, and then followed by.
Let the affect.
Any other?
Third part of duodenum, second, third, fourth part.
Second, third, fourth part, except the first part. Rest of the duodenum. Duodenum, except
Ascending pronoun. Ascending pronoun.
first part. Except first part, okay. Ascending and descending pole. Okay. Anything else? Descending pole. Rectum, if you come below the peritoneum, you will see that later. Okay. First of all, the retroperitoneal organs, try to remember these things. Based on this, you can understand the peritoneum very easily. Okay. First of all, one of those kidneys with the suprarenal gland, which is lying above the kidneys, and then connecting to the kidneys will be the ureters over here. Okay. So entire excretory system is behind the peritoneum over here. Okay. Right. And then followed with the pancreas. Okay. Pancreas, you know that very well. What it functions and everything. Okay. Pancreas, and then followed by large intestine plus small intestine over here. Small intestine, nothing but the duodenum, except the first part of the duodenum. So duodenum has only 4 parts. First, second, third, and fourth parts. Among them, except the first part, second, third, and fourth parts are retroperitoneal. Okay, among the small intestine. So jejunum and ileum are, we'll be seeing that later. Okay, and then followed by ascending and descending colon. So what you by this what you can understand, all these are behind the peritoneum over here. Behind the peritoneum towards the posterior abdominal wall. Okay. So if you open the abdomen, you can't see all these structures until unless you remove the peritoneum over here. Getting it out? Right? So these are the structures which are retroperitoneal. So we have found out all the retroperitoneal organs. Okay. So we are supposed to understand which organs are lined by the peritoneum. Okay. So apart from these things, rest of the things, structures will be lined by the peritoneum. That means, for example, the liver, for example, you take. First of all, the liver. Okay. Liver will be enveloped by the visceral peritoneum. That will again connected with the parietal peritoneum. Stomach also will be enclosed by the visceral peritoneum. Again, it will be connected with the parietal peritoneum. Okay. So in this manner, rest of the organs will be connected with the parietal peritoneum through the visceral peritoneum. How will we see now? Okay. And then few organs are called the subperitoneal organs. Okay. For example, this is again anterior abdominal wall, and this is the pelvic cavity over here. This is the pelvic, this is the peritoneum over here. So the structures which are present in the pelvic cavity are subperitoneal organs. What are those things? First of all, from the anterior to posterior direction, there will be urinary bladder over here, and then followed by, in case of females, there will be uterus, which will lie over the urinary bladder over here, and then followed by rectum. Absolutely, this is the rectum. Now you can understand what about the rectum over here. So you will understand, it is not retroperitoneal. Only some part will be the retroperitoneal. We'll see that later. Okay. So all these pelvic organs are below the peritoneum over here. This is the superior aspect towards the diaphragm. This is towards the pelvic cavity over here. This pelvic cavity contains urinary bladder in front, then followed by the uterus in case of females, which will be absent in case of males, and behind that will be the rectum and anal canal over here. Get it up? So all these organs are subperitoneal organs. So far we have seen retroperitoneal organs and subperitoneal organs. So apart from these, the rest of the things will be covered by the peritoneum. Getting it all right? We'll see that.
So what about the diaphragm?
Diaphragm is also covered by the peritoneum. That's what I'm telling you. Okay. We'll discuss. First of all, you know the disposition of the organs are not based on that you can understand. Okay. First of all, let us see the disposition first of all. First of all, this is the diaphragm. For example, this is the diaphragm. Which the two domes. Okay. And domes also. Okay. For example, this is the right dome of the diaphragm. This is the left dome of the diaphragm, for example. Okay. Where the liver is situated over here, liver will be situated over here in this manner. Okay. Liver will be situated in this manner. Okay. Right. So just below the diaphragm, there will be liver. Okay. Just towards the left side there will be okay, spleen. First of all, let us see the stomach over here. Stomach will be coming here. How it will be coming here? Towards the right side, just below the diaphragm is the liver over here. Towards the left side, just below the diaphragm will be the stomach over here. Getting it? Just towards the left side of the stomach will be the spleen. Okay, spleen will be in this manner. Okay, towards the left side of the stomach will be the spleen over here. Okay, if you consider these as a sequence over here, then you can understand what are the different pouches and everything. Okay, first for the liver on the right side, then followed by the stomach, then followed by the spleen over here. Okay, and below the stomach there will be so this is the transverse colon over here, just below the stomach. Remember all these things properly. Okay, just below the stomach will be the transverse colon over here. Okay. So on either sides, obviously there will be ascending colon, transverse colon, and descending colon. Descending colon continues with sigmoid colon. Then sigmoid colon continues with rectum and finally the anal canal. So within this part there will be small intestines, right? These are the small intestines. So just remember over here. So this is the basic disposition of the viscera within the abdominal cavity. Okay, let us see that. So just below this, so far we have seen the upper part of the abdomen over here. Now we are focusing on the middle part of the abdomen over here. So this middle part of the abdominal region contains small intestines like duodenum. Okay, after the stomach there will be duodenum over here. Then followed by jejunum and then followed by the ileum. Jejunum is most probably situated towards the left side. Most probably. Okay, that doesn't mean it is not present in the right side. Most of the jejunum will be present towards the left side. Okay, and most of the ileum will be present towards the right side over here. Getting it on? So if a patient is complaining of pain in the middle at the level of the umbilical region, so there might be an infection which is situated in which organs among these things? Small intestines, absolutely. If the patient is complaining of pain over the right side of the abdomen, where the infection might be? Ascending colon over here. The patient is complaining on the left side, descending colon over here. So if the patient is complaining towards the lower aspect hypogastric region, tomorrow we will be discussing the planes over here. Okay? Hypogastric region, probably sigmoid colon, or towards the rectum over here. Getting it on? So if a patient is complaining of pain in the abdomen, within the center for example, okay? So that indicates the small intestines. Towards the right side and left side, that indicates the ascending and descending colon. Towards the lower aspect, towards the pelvic region, sigmoid colon or rectum over here. Get it on? Towards the upper part, towards the diaphragm, if the patient is complaining of the pain, either stomach or liver or gallbladder, you can say, and spleen also. For example, the patient met with a road traffic accident. So this sided ribs got fractured, that will be penetrating into the spleen over here. So obviously the patient will be complaining of pain over the left side and the patient is found to have low BP. What might be the reason? Patient met with an accident. For example, patient is going on the crossing a road, suddenly a vehicle hit from left side over here, this manner. So the spleen is covered by 9, 10 and 11th ribs over here. Okay, 9, 10, 11 ribs over here. Okay. So if the fracture of the ribs occurs over here, so that will be penetrating because the injury is in this manner, impact is in this manner. So the fractured ribs will go inside, hitting the spleen over here. So the patient obviously will be complaining of the pain over here. And later on, whenever the time is going on, the patient is found to have low BP and more pulse rate. What might be the reason? Internal bleeding, absolutely. Internal bleeding. Why internal bleeding? Especially for the spleen. Why not for the intestines? Or why not for any other structure? That is destruction, okay?
Total
reason
What is
total vein.
total vein? It's okay. Neither. So what is the spleen? Spleen is over or not? Histology?
Spinning artery.
No, splenic histology is over or not? No, okay, fine. Over, huh? No, nothing. It's okay. It's okay. It's okay. It's okay. The basic. Come on. Come on. Okay. Because I have to dissect in front of you. Because I have preserved the parietal peritoneum of the superficial aspect. So I have to cut it open. So it will take some time. Okay. So let us focus.
Smell or not? The body smell or not?
Yes, then so you are a doctor, no? You have to feel all the smells. Okay, fine. Sorry. So the thing is, the blood will be temporarily stored in the spleen. Because to destroy the RBCs, the blood will be continuously going through the spleen and exchanging. Is it or not? So at this moment, whenever the blood is entering into the spleen acts like a temporary storehouse. Okay. So blood will be stored within the spleen, just like a sponge with the water. Okay. So whenever an injury occurs to the spleen, there will be more blood loss. So that is why the patient is undergoing low BP and more pulse. Now the BP reduces, pulse rate will automatically increase. Okay. So based on these facts, you can understand to which organ the problem would have occurred. Based on these locations, you can understand. Towards the upper aspect, either liver or stomach or the spleen, and towards the middle aspect, either small intestine or large intestines, and towards the lower aspect, you can think of large intestine over here. And further downwards, there will be injury to the bladder or uterus or anal canal, anything, whenever it is in the pelvic cavity. For example, there is a fracture of the pelvis. You can think of urinary bladder or uterus or anal canal and rectum over here. Okay. Concerned with the abdominal cavity, these are the structures which are generally injured or infected. Okay. So this is the disposition, basic disposition. Okay. So you can't be able to see the pancreas over here. You can't be able to see the kidneys also over here because those are behind. Get it out? Even these two also got plastered to the posterior abdominal wall by means of a peritoneum over here. You can't see the ascending and descending colons over here. Could you understand? So whatever you could able to see after removal of the parietal peritoneum over here are these organs. Could you understand? Right? You can't see the ascending colon or the descending colon over here. And you can't see the kidneys and pancreas also you can't see. Ureters also you can't see. And of course duodenum also you can't see. Could you understand? Right? So let us see how the parietal peritoneum is becoming visceral peritoneum. For this you have to understand the basic thing over here. Let us focus the main important topic now. Okay. First of all, imagine that this is the liver over here, this is the stomach, and this is the transverse colon over here. Okay. Now we are focusing on the parietal peritoneum reflecting over the viscera and become the visceral peritoneum over here. Okay. So far we understood the retroperitoneal organs just behind the peritoneum are these structures over here. Okay. So kidneys will be located over here, pancreas will be located over here, duodenum will be located over here. Okay. So all these structures will be over this region. So within the cavity, these are the different organs over here. Okay, let us see that. First of all, so this is the anterior aspect of the abdominal wall. This is the posterior wall of the abdominal cavity. This is towards the diaphragm, and this is towards the pelvis over here. Okay, right? Here will be the urinary bladder and uterus and rectum. Okay. So now we are within the peritoneal cavity now. Okay, let us see. So See here, first of all, see here, the peritoneum contains two layers. One is the parietal layer and one is the visceral layer. Visceral layer means if the peritoneum is covering the organs, abdominal organs, that is called the visceral layer of the peritoneum. Okay. So this peritoneum is made up of, the peritoneum is nothing but serous. What is it? Serous membrane over here. Serous membrane means?
Serous secretion.
Serous membrane means what? Loose cellular connectivity, that's okay. What is epithelium? There will be squamous epithelium with the loose cellular connective tissue deep to that. Okay. So where the epithelial cells are situated and where the loose connective tissue is situated over here in this peritoneum. For example, this purple color is the peritoneum, parietal peritoneum over here. To which side the cells and the connective tissue will be present?
Epithelial outside and epithelial outside.
Towards the outside will be
Epithelium.
epithelium, okay then. Towards the inside will be loose cellular connective tissue. Why so? What's the need?
No, sir. So epithelium will be in the inner side.
Absolutely. Epithelium must be on the inner aspect over here. And loose cellular connective tissue must be on the outer aspect over here. Okay, do you understand that? Epithelium must be towards the inner aspect within the peritoneal cavity because that will be secreting the peritoneal fluid over here. And you can understand outside the peritoneum there is an extra peritoneal fat where the fat will be present generally within the connective tissue. Is it not? Right? Not within the epithelium, within the connective tissue the fat will be present. So this is the extra peritoneal fat over here. Getting it or? So to secrete the secretions into the peritoneal cavity, the epithelium, which is a squamous epithelium, should be situated towards the peritoneal cavity. Outside the peritoneal cavity will be the connective tissue, loose areolar connective tissue. Okay, this is the basic thing. So many have not written with the pleura. Pleura is made up of serous membrane, obviously. Okay. Let us see that. So how the peritoneum is hanging different organs over here. First of all, so this anterior wall, for example, this is the anterior wall of the abdomen over here. On the inner aspect, it is lined by the parietal peritoneum. Is it not? This parietal peritoneum on either sides it will be coming over here, and in the center it will be reflected in this manner, which is termed as the falciform ligament. What is it? Falciform ligament. Okay, so falciform ligament will be invaginated in this manner. Okay, for example, this is the anterior abdominal wall over here. So the two areas of the anterior abdominal wall, there is a reflection in this manner. So that is nothing but the falciform ligament. Okay, this falciform ligament will be encircling the liver in this manner. The two layers of the falciform ligament will be encircling the liver over here. Get it now? So for example, if the liver is situated, for example, this is the liver over here, for example. Okay. So the falciform ligament will be coming in this manner. Get me now? So two layers. For example, my thumb is one layer, right sided layer, my fingers are the left sided layer. Okay. Both will be joined with the liver over here and they will diverge in this manner. Getting it now? So this layer will be occupying the right side of the liver and left layer will be occupying the left side of the liver. Do you understand? First of all, it is enclosing the liver which is on the right side of it. Getting it? From the liver, these two layers will be reflected over the stomach now. From the liver all the way towards the stomach in the name of an momentum called. What is meant by momentum actually? Peritoneal fold? For the stomach? Peritoneal fold? Okay, fine. If any peritoneal fold connecting the stomach with the other organs, that area of peritoneum is termed as momentum. Get it now? So this layer from the from the wall of the abdomen till the liver, this part of peritoneal is termed as falciform ligament over here. All the way from liver to the stomach, there will be one more connection. The same layers will be continued over the stomach over here. So this part is termed as the lesser momentum. Okay. For example, you take the stomach over here. If you take the stomach over here, so this is called the lesser curvature, this is called the greater curvature. Based on the curvature you can understand. Okay. Towards the right side is the lesser curvature, towards the left side is the greater curvature. This is the anterior superior surface, that is the posterior inferior surface. Okay. The liver is situated in the, stomach is situated in this manner. Anterior superior surface and posterior inferior surface, lesser curvature and greater curvature. Okay. So, from the liver over here, from the liver, whenever it is occupied by this falciform ligament in this manner, all the way from the anterior abdominal wall, it is going in this manner, and this layer will be covering the right side of the liver, and this layer will be covering the left side of the liver over here. So these two layers will be going back towards the behind aspect of the liver, and from the behind aspect of the liver, that will send two layers towards the stomach over here. Could you understand? First of all, initially from the anterior abdominal towards the anterior surface of the liver, it will occupy the entire liver most posteriorly. From the posterior aspect, it will be connected to the liver over the lesser curvature in this manner. Here you go. So from the liver, there will be two layers going over here in this manner. Do you understand it? These two layers over here are these two layers after going back over here. Could you understand? Connecting the liver on the posterior aspect with the lesser curvature of the stomach over here, till the first part of the duodenum over here. Getting it out? Right? So liver is enclosed by peritoneum over here, and then followed by the same two layers will be going towards the stomach, and these layers will be enclosing the stomach again. Could you understand? The same two layers will be enclosing the stomach over here. Enclosing the stomach in this manner. Could you understand? The same two layers all the way coming from the posterior aspect of the liver, enclosing the lesser curvature of the stomach and enclosing the entire anterosuperior surface and posterior inferior surface of the stomach. Getting it? And then after reaching the stomach, so this is the lesser curvature from the liver, lesser curvature of the stomach. And then opposite to that will be the greater curvature of the stomach over here. So from this greater curvature, again the two layers will be joined in this manner. See here. So here you are supposed to understand these things over here. See here. Whenever the peritoneum is reaching the greater curvature over here, then the two layers will be connected with each other. Getting it over? Initially from the liver, the two layers went towards the lesser curvature of the stomach and enclosed the entire stomach, and again joined at the level of the greater curvature of the stomach over here, and further they will be joining and forming the two layers. Getting it over? So these two layers will be hanging downwards over here. For example, this is the stomach over here. This is the greater curvature of the stomach. Getting it? From this, there is a curtain-like greater omentum. So this part of the omentum is called the greater omentum. Now, why this is called the greater omentum? Because it is connecting the stomach with the transverse colon over here. See that? So the anterior layer, posterior layer over here, going downwards and turning over here in this manner. Getting it? For example, this is the first layer. This is the first layer over here. Nothing but the anterior layer, and this is the second layer, nothing but the posterior layer. So this is the stomach, for example, this is the stomach, lesser curvature and greater curvature. So peritoneum will be enclosing it in this manner. Get it? So these two layers are the lesser omentum. Whenever it is reaching the greater curvature, these two layers are called the greater omentum. Okay, but the greater omentum will be in this curved margin over here. So greater omentum will be hanging like a curtain below. Getting it out, right? So the greater omentum will be hanging in this manner. Greater omentum will be hanging in this manner. Greater omentum will be hanging in this manner. Could you understand? So this is the lesser omentum enclosing the stomach, then followed by the greater omentum will be hanging in this manner. Deep to this omentum will be all the intestines, small intestines over here. Could you understand? So this entire curtain sort of thing is made up of this thing over here. This is the anterior aspect, this is the anterior aspect over here. So this is the anterior aspect over here, you can see that. So these are the two layers over here. Could you understand? Okay. These two layers, one is the anterior layer, one is the posterior layer. This is the anterior layer, on the other side is the posterior layer. Okay. goes downwards in the pelvic cavity, till the pelvic cavity, and then folds backwards. In this manner, it will be folding back. From the anterior aspect, it is going back towards the posterior aspect now. So the first layer is becoming the fourth layer over here. Could you understand? And the second layer, which is going over here, is becoming the third layer over here. So totally 4 layers of greater momentum over here. But whenever, so this is in the childhood stage over here. Whenever it becomes adult, this will be entirely will be atrophied over here. Could you understand? Right? So this part will not atrophy, that will be joined with each other. Getting it out? These 2 layers, these 4 layers will be joined with each other. Okay. So now consider these 3rd and 4th layers over here. The 3rd and 4th layers of the greater momentum will be reaching the transverse colon and they will diverge with each other. Diverge from each other. Okay. So this is the 3rd layer now going over here above the transverse colon and in front of the transverse colon over here. And this is the 4th layer which is going behind and below the transverse colon over here. Could you understand? Now this is actually sagittal section. Could you understand? This is the sagittal section. Okay. So the 3rd layer will be going and enclosing the transverse colon above and in front over here. And the 4th layer will be going over here, enclosing below and behind the transverse colon over here. Okay. From this part, these 2 layers again go towards the pancreas over here. This part is pancreas over here. It's triangular in shape. You will see that later. Okay. Pancreas is a retroperitoneal organ. So this is the anterior surface of the pancreas and this is the inferior surface of the pancreas over here. For example, pancreas will be triangular in this manner. This is the anterior surface, this is the inferior surface, this is the anterior border of the pancreas over here. Could you understand? Pancreas will be in this manner. Anterior border, anterior surface and inferior surface. And this is towards the posterior wall and towards the base. Okay. So base towards the posterior wall, anterior border, anterior surface and inferior surface over here. So these 2 layers will diverge at the level of this pancreas, overlapping the pancreas over here. Could you understand? So this is the pancreas which is a retroperitoneal organ over here. At the anterior border of the pancreas, the 2 layers will diverge over here. And again, that will join with the parietal peritoneum in this manner. Could you understand? Right? So this layer will be going backwards and enclosing the transverse colon just below the stomach over here. From that it will go again backwards and diverge at the level of the pancreas and becomes the parietal peritoneum again. Understood or not? So it has started all the way from parietal peritoneum of the anterior wall and enclosed the liver and then followed the stomach and then followed the transverse colon and went backwards and again became the parietal peritoneum over here. Could you understand? Anterior wall parietal peritoneum now has become the posterior wall parietal peritoneum in this manner. Understanding about it? So because of this peritoneal folds, these viscera are hanging within the abdomen. Could you understand? Right? So this is the connection within the peritoneal cavity over here. Getting it out? So whatever the peritoneum you are seeing around the stomach, around the liver, around the transverse colon, these are the visceral peritoneums over here. Could you understand? So this is the parietal peritoneum and whatever the peritoneum around the stomach or around the transverse colon or around the liver, those are called the visceral peritoneums over here. Could you understand that, right? Not atrophy, they will be attached with each other. Not atrophy, they will be attached with each other. They will be joined. They will be joined with each other. Exactly. Then they will form single. That again will divide. Only this part will be joined with each other. Okay, that will attach with each other.
So what about the spleen?
Spleen will discuss. Okay. First of all, from the liver and then to the stomach and then towards the transverse colon. This is the basic thing. Everybody understood or not? Right? So, let us imagine the other things over here. So, whatever you are seeing over here, there are 2 sacs in case of peritoneum. One is a see here, there are 2 sacs within the peritoneal cavity. One is the greater sac and one is the lesser sac over here. Try to understand this. Greater sac and lesser sac. Lesser sac is also called omental bursa. Okay, omental bursa. Based on this, you can understand where this lesser sac is situated. Omentum, where it is situated? Omentum, where it is situated? So this is the lesser omentum, this is the greater omentum. So greater sac will be in front of the stomach, lesser sac will be behind the stomach. Blindly you can remember. In front of the stomach, this entire cavity is the greater sac. Behind the stomach, this entire cavity is the lesser sac. Could you understand? The lesser sac is also called the omental bursa because the stomach will be expanding within the omental bursa. If you eat nice biryani or any, what is it, chow mein or whatever. Okay. So the stomach will be expanded, that expansion will be carried by this lesser sac over here. There you go. So the stomach will be expanding into the lesser sac. Okay. So that's why it is called the omental bursa. Okay. So this entire part is the greater sac, all the way extending from the diaphragm till the pelvic cavity over here. So this entirely in front of the stomach is the greater sac of the peritoneal cavity. Get it or not? So behind the stomach, this closed sac is nothing but the lesser sac. So where you can expect the lesser sac? Behind the stomach, reaching till the liver over here. Could you understand? So behind the stomach, reaching the liver over here. That means behind the stomach, reaching the liver is the lesser sac. In front of the stomach, this entirely is the greater sac. Could you understand? The parietal peritoneum is over here in this manner. Okay, for example, this is the anterior abdominal wall. This is lying by the parietal peritoneum, all the way from diaphragm till the pelvic cavity over here. So in between the liver, stomach, intestines and everything, this sac of the peritoneum is called the greater sac. Behind the stomach, this smaller part reaching the diaphragm behind the stomach till the liver, that is called the lesser sac. Could you understand? In front of the stomach is the greater sac. This entire cavity is the greater sac over here. Behind the stomach, the smaller area is nothing but the lesser sac over here. Getting now, right? So these two sacs, if you see properly, are communicated at this level. Try to understand. Okay. Greater sac is communicating with the lesser sac behind the stomach through a foramen over here, that is called the epiploid foramen of Winslow. Foramen of Winslow. This is very much important. Foramen of Winslow. Where the foramen of Winslow is located over here. See properly over here. This is the lesser omentum. This is the lesser omentum. This omentum is attached to the entire lesser curvature over here. Entire lesser curvature. So this border is fused with the lesser curvature of the stomach. Okay. But over here, this part of the lesser omentum is absolutely free. It is not attached to any organ over here. Getting it or not? So this is the duodenum over here going downwards in this manner. So the lesser omentum will be in between the liver, posterior aspect of the liver, and the lesser curvature of the stomach. Getting it or not? The two layers will be connected in this manner. Okay. So this part, this border is absolutely joined with the lesser curvature of the stomach over here. But this border is free from the attachment to any other organs over here. Getting it? So this makes a way for the communication between the greater sac and lesser sac over here. I will be showing you later on the viscera. Okay. So this entire greater sac over here passing through this gap and enters into the lesser sac. So this area is called the foramen of Winslow or epiploid foramen over here. So what is the clinical importance over here? For example, if there is a perforation of the stomach occurs over here, for example, on the anterior superior surface of the stomach, there is a perforation occurs over here because of the gastric ulcer. So all the gastric contents will be leaked into the which sac over here? Greater sac. So if the infection has spread through the entire greater sac, obviously it will be filled with a pus. Is it not? So is there a chance from here the pus will be entering into the lesser sac over here? So there is a communication between the lesser sac and the greater sac. So the infection all the way from greater sac will be passing towards the lesser sac over here. Okay. So within the lesser sac, what are the things which are present over here? Very close to the lesser sac is the pancreas over here. Towards this side will be the spleen. Okay. Those might be get infected. Getting it over? So the infection might spread to the liver also over here. And kidneys will be situated on either sides over here. So that infection might spread to the kidneys also. Getting it down? So this is the clinical importance for this foramen of Winslow or epiploid foramen. Do you understand? So the infection from the greater sac will be going towards the lesser sac and infecting the rest of the structures over there. And the same thing, if the infection occurs over this part, if there is a perforation in the posterior inferior surface of the stomach, there will be collection of the pus over here within the lesser sac. Okay? This collection of pus may communicate with the greater sac and will enter into the greater sac over here. Getting it down? Right? So this is about the basic thing about the visceral peritoneum over here. Okay? We will see rest of the things. Okay? Okay, let us see the cross section now. Okay, let us see the cross section. So far we have seen the sagittal section over here. Okay, how the liver, stomach, transverse colon, and the pancreas are connected through all these layers. Okay, now we will see on either sides how the peritoneum is going over here. Okay, first of all, this is the liver, for example. Just imagine this is the liver over here. This is the right kidney. This is the left kidney over here, and this is the spleen, and this is the stomach. Could you understand everybody? So cross section, we are looking from above downwards now. Okay, this is the liver, stomach, right and left kidneys, spleen over here. So along with them, vessels will be present. One of those vessels towards the right side will be inferior vena cava. Towards the left side will be abdominal aorta. This is the inferior vena cava. This is the abdominal aorta. So now, how the parietal peritoneum is going and becoming the visceral peritoneum. Okay. So far we have seen the falciform ligament will be attached over here to the liver, all the way from anterior abdominal wall, and towards the posterior abdominal wall. This will be connected with the stomach, lesser curvature in this manner. Okay. Here will be the epiploid foramen. Okay. And this will be occupying the entire stomach over here. Of course, this is a greater curvature. This is a greater curvature, for example, will be hanging over here in this manner. Is it not? This is a lesser curvature, for example. This is a lesser curvature, for example. This is a greater curvature. Okay. This is lesser curvature, greater curvature over here. So part of this peritoneal fold, whenever it is joining over here, is it not? On one side, these two layers will be joined over here, and they will diverge and enclose the stomach. And again, the two layers will be joining over here. Is it not? That's why the greater omentum is formed over here, right? So part of this greater omentum will be going and enclosing the spleen in this manner. See here, listen carefully over here. This part is the actual greater omentum. Okay. So part of the greater omentum is having two layers. Is it or not? One is the anterior layer, one is the posterior layer. So leave about the posterior layer. This anterior layer is present over here. Then part of the anterior layer will be going towards this is the hilum of the spleen. Okay. There are a few borders and surface of the spleen, but towards the right side of the spleen there is the hilum through which blood vessels enters and comes out. Okay. So or towards the stomach is the hilum of the spleen, you can say that. Okay. So this anterior wall will be reaching the hilum on the anterior aspect. So this is the anterior aspect and this is the posterior aspect because kidneys are present over here. Okay. So this anterior layer will be enclosing the spleen as a whole. Getting it out? This is enclosing the spleen as a whole and will be reflected over the kidneys over here in this manner. Will you understand? So see here properly everybody. So now see here the anterior layer will be enclosing the spleen and from here it is reflecting towards the left kidney over here. Okay. The layer of the peritoneum, okay, and one more layer, the posterior layer will be going over here and is joining with the in front of the kidney, the peritoneum in front of the kidney over here. Is it not? Right? Let us see that now. So this part is the lesser sac and here will be the greater sac. Is it not? Here will be the greater sac and here will be the lesser sac, right? So see here, this part of the peritoneum, the anterior wall and the posterior wall of the peritoneum or omentum, you can say that, is termed as a ligament over here. In between the stomach and the spleen, which is called the gastrosplenic ligament over here. In between the stomach and the spleen, this connection of the omentum is termed as the gastrosplenic ligament. The same anterior layer will be going towards the kidney over here, connecting the spleen with the kidney. This is termed as the another ligament that is termed as leno-renal ligament. Leno means spleen and renal means kidney. Leno-renal ligament over here. But you will understand, right? If you see the lesser sac will be going over here. This small portion is the lesser sac which is lying in front of the kidneys and the great vessels over here. Could you understand it? Right? So just behind the stomach is the lesser sac. In front of the stomach, this part will be the greater sac. Could you understand? To make it better. Okay, this part is the greater sac of the peritoneal cavity. This part is the lesser sac of the peritoneal cavity. Okay, right. So this part is the lesser sac. You can see the boundaries of the lesser sac. In front will be the lesser omentum and the peritoneum covering the stomach over here. Behind this is the peritoneum which is covering the kidneys and everything over here. Towards the right side will be the liver and towards the left side will be the spleen. Are the boundaries of the lesser sac over here. Could you understand? Imagine that stomach is present over here and spleen is over here and kidneys are behind. So stomach, spleen and left kidney are connected by means of ligaments of the peritoneum. Getting it now? For example, the stomach is enclosed by the anterior layer of the omentum over here and that is enclosing the entire spleen and going towards the left kidney. Getting it now? The same anterior layer connecting the stomach and the spleen and the kidney over here. The same layer. Forming the ligament is called gastrosplenic ligament and leno-renal ligaments over here. Try to understand this problem. This is the anterior layer of the peritoneum over here. This is the posterior layer of the peritoneum. So the posterior layer of the peritoneum is related with the lesser sac over here, but the anterior layer of the peritoneum is related with the greater sac over here. Could you understand? In front of the stomach is the greater sac, behind the stomach is the lesser sac. So in front of the stomach will be the anterior layer of the peritoneum, behind the stomach is the posterior layer of the peritoneum. Isn't it? Right? So this anterior layer will be enclosed. Only the anterior layer will be enclosing the entire spleen and going towards the kidney over here. And that joins with the parietal peritoneum over here. Get it? And then the lesser sac, see here, this is the posterior layer that will be continuous over here and becoming the lesser sac over here. That means making the kidneys retroperitoneal by means of this posterior layer of the peritoneum over here. Getting it out, right? So, whenever this closed cavity is present over here, this closed cavity is called the lesser sac. Okay? Behind the stomach is the lesser sac. Getting it out? So, the posterior layer of the peritoneum belongs to the lesser sac and the anterior layer belongs to the greater sac over here. Could you understand it, right? So in this manner, horizontally, the peritoneum is displaced over here. Do you understand it? Right? Above downwards from the liver to the stomach and to the transverse colon and towards the pancreas over here. And horizontally, it is extending in between what? Stomach and the spleen and going in front of the kidneys over there. Could you understand it? Right? So whenever it is going over the kidneys over here, there will be transverse colons also, ascending and descending colons also over here on either sides. Could you understand? Right? So the pancreas is situated just behind the stomach over here. Okay. On either sides will be the kidneys. The pancreas will be related to the kidneys. If the kidney is present over here, for example, the left kidney and right kidney will be over there on either sides. The pancreas is situated in this manner towards the posterior abdominal wall. Here will be the left kidney, here will be the right kidney. Both will be making the relations with the kidneys over here. Do you understand? Right? So where the pancreas is situated towards the upper part of the abdominal cavity. Do you understand? Towards this part is the pancreas on the back side over here. Do you understand? Wherever the stomach is present, behind the stomach is the pancreas over here. Behind the pancreas on either sides will be the kidneys, right and left kidneys over here. And on either sides of the kidneys there will be ascending and descending colons. Could you understand? Right? Okay. So these kidneys and the pancreas which will be present over here and the ascending and descending colons are are behind the peritoneum, parietal peritoneum over here. Could you understand, right? Everybody? Okay. So we'll go to the dissection. Okay. This will be discussed again in the lecture class.
Further.